Bone anatomy of the orbit consists of 7 bones, which are frontal bone, ethmoid bone, sphenoid bone, lacrimal bone, orbital process of palatine bone, zygomatic bone, maxillary bone. The medial wall is formed primarily by the orbital plate of ethmoid, as well as contributions from the frontal process of maxilla, the lacrimal bone, and the body of the sphenoid. It is the thinnest wall of the orbit. The lateral wall is formed by the frontal process of zygomatic, and more posteriorly by the orbital plate of the greater wing of sphenoid. The bones meet at the zygomatico-sphenoid suture. The lateral wall is the thickest wall of the orbit. The roof superior wall is formed primarily by the orbital plate frontal bone, and also the lesser wing of sphenoid near the apex of the orbit. The floor inferior wall is formed by the orbital surface of maxilla, the orbital surface of zygomatic bone, and the orbital process of palatine bone. The foramina present in the orbit are superior orbital fissure which separates orbit from the spheno-palatine fossa and optic canal, anterior and posterior ethmoidal foramina in the medial wall. Medially, near the orbital margin, is located the groove for nasolacrimal duct. Near the middle of the floor, located infraorbital groove, which leads to the infraorbital foramen. The floor is separated from the lateral wall by inferior orbital fissure, which connects the orbit to pterygopalatine and infratemporal fossa. The dimensions of the orbit. The volume of the orbit is about 30 centimeters cubic, while the globe occupy about 7 centimeters cubic only of the total volume. The height is about 35 millimeters and the width is about 40 millimeters as measured from orbital rims. The depth of the orbit from the medial orbital rim to the apex of the orbit is about 45 millimeters. From the inferior orbital rim the floor dips slightly inferior from the rim, then curves cephalically towards the superior orbital fissure. Superior orbital fissure is located medial to the orbital apex. Contains superior ophthalmic vein, anastomosis branches of middle meningeal and recurrent lacrimal arteries, oculomotor nerves 3, 4 and 5, first division ophthalmic of trigeminal nerve. Optic canal is located at the apex of the orbit medial to superior orbital fissure. It is 5 millimeters wide and about 1 centimeter long. Contains optic nerve. Anterior and posterior ethmoidal foramina. Anterior ethmoidal foramen presents about 25 millimeters from medial orbital rim, contains anterior ethmoidal branch of nosociliary nerve. Posterior ethmoidal foramen presents about 35 millimeters from medial orbital rim, contains sphenoethmoidal branches of nosociliary nerve. They contains interior and posterior ethmoidal arteries respectively. Posterior ethmoidal foramina is the landmark of safe dissection from the medial orbital rim. Nasolacrimal foramen is present at inframedial wall of the orbit. It contains nasolacrimal duct. There is anterior lacrimal crest present anterior to the canal, serves as attachment of the anterior fibers of medial canthus. Deeper fibers along with orbicularis oculi attached to the smaller posterior lacrimal crest. Whitnell's tubercle is present in the lateral orbital wall at zygomatic frontal suture, act as attachment of lateral canthus and globe suspensory ligaments. Inferior orbital fissure is located 1 centimeter from inframedial orbital rim, connecting the pterygopalatine fossa with orbital floor. The contents of this fissure are V2 infraorbital and zygomatic sensory nerves, inferior ophthalmic vein, branches of pterygoid plexus and parasympathetic branches of sphenopalatine ganglion.